So I'll get started. Well, thank you everybody for tuning in. Today's webinar we're focusing on the role of Vermont school nurses in community organizing and COVID-19 recovery efforts. And we'll be hearing from several leaders from the Vermont State School Nurses Association, who I'll introduce in just a minute. But I'm Maeve Power. I'm an organizer with VPIRG, working mainly on our COVID-19 response work right now. We've refocused a lot of our priorities to be largely focused on Vermont's response and recovery efforts, and you can learn a little bit more about that by visiting our website at vpirg.org. On there, you'll also find more information about this webinar series and replays of some of the others that we've hosted. So we chose to do these in a live format so that participants who have questions can submit them in real time. So if anything occurs to you that you'd like to ask our speakers, feel free to drop it in the chat and I'll try to, work it into our conversation. So without further ado, I'll introduce our speakers. We have Sophia Hall, school nurse at Miller's Run School in Sheffield. She's also the president of the Vermont State School Nurses Association, which I'll now just call VSSNA from now on. We also have Clayton Wetzel, who is the school nurse at Waitsfield Elementary. And he's the Vermont director for the National Association of School Nurses and the webmaster at VSSNA. Rebecca McCrae, school nurse at Edmonds Middle School and president-elect of VSSNA, and Kelly Landwehr, Middlebury Union High School school nurse and VSSNA secretary. So I'll pass it along to each of our speakers to give a little bit more background as to who they are before we get into the nuts and bolts of the conversation. But Sophia, would you like to take it away?
Thank you, Maeve. First of all, I want to thank you very much for having us here today. As you know, today is a very special day for school nurses. This is National School Nurse Day. And I'd like to take a shout out to all of our Vermont State school nurses for all the hard work that they do on a regular basis and will continue to do, supporting students and staff. I would not want to be a teacher without a school nurse in my school. So again, thank you for having us here. I started my nursing career 40 years ago now. Seems a little weird. I've done a variety of things, but throughout it all has been interactions with children and parents and families all through the spectrum. I've been the school nurse at Miller's Run School now for 7 years, and I was school nurse in northern Idaho for 4 years in the distant past. I have my 21-year-old daughter is home with me, so that's why I have a headset on, because she's doing her schoolwork as well. I just am so appreciative of all the school nurses and the work that they do. Even when school is not in session, like now, the school nurses continue to support students with critical health needs and chronic illnesses by connecting with them remotely or by phone or through video chatting. The parents and the students have gotten used to that support during the school year, and it's important to continue to maintain those relationships even now.
And I think that maybe I will take over from here, Soph, if that's okay, and talk a little bit about School Nurse Day. So I'm Clayton Wetzel, and I am a school nurse at Waitsfield Elementary School in Waitsfield, Vermont. I have been a nurse for 9 years. I've been full-time at Waitsfield for about 7, but working at Waitsfield since 2012. And prior to that, I was a government contractor for 20 years, and I started on submarines prior to that too. So I've done a myriad of different things in my career. But I have to say that working in school nursing has been just amazing to me. I work with elementary school students, so pre-K to 6th grade, and I find in my practice that I use humor mostly is one of the primary things, because if I can get a child to laugh when they come into the office, typically I can help them get over whatever's causing the problem, and if they don't, I'm always doing an assessment, but figuring out the severity of the issue at that point. So with that, School Nurse Day was something that was started by the National Association of School Nurses in 1972, and it was to recognize the school nurses and acknowledge their role in the educational setting. So in Vermont, we are licensed. We have dual licensing. So we are licensed by both the Department of Nursing as well as the Agency of Education, and we have an educator license with an endorsement in either as a school nurse or an associate school nurse. So, we are actually acting on the behalf of two different organizations when it comes to the Vermont Department of Health as well as the Vermont Agency of Education. So this year's theme for the School Nurse Day was School Nurses Supporting Students in Time of Crisis. Now, obviously that became very important as this year has progressed with COVID specifically and the pandemic. So it really reinforces the changing times we're in as 2020 has gone forward, going from working in our office in direct care to triaging via phone or just talking like Soph talked about before, on the phone, video chatting, staying in communication any way we can, texts, whatever that happens to be. And it shows that school nurses are now taking on an unprecedented role, and we're adapting quickly to the change. As things are slowly changing or becoming like every day is a little bit different, we have to roll with those and really make decisions based off of that. And then, and it's reflective of the fact that there are significant impacts that the school nurse has for the healthcare of their schools and their communities. That's for making it a healthier place for the children and the families. And I'd just like to share a quote from the president of the National Association of School Nurses, that's Lori Colm. And she said, the COVID-19 pandemic has emphasized the essential school nurse role. Whether we are physically present in our health office or working virtually in support of our students, the role of the school nurses in public health, in policy development, and in care coordination and education is essential. So the school nurses, we have a fairly small population in Vermont. You all are aware of that. But I did a quick calculation, and we have approximately 340 schools and 53 supervisory units or school districts, and then a bunch of independent and private schools also. So that means that we could have up to 340 school nurses plus, although some schools are larger and do have additional nurses in them. I don't have an exact number on school nurses right now, but we all bring, we work independently. So we're typically the primary healthcare provider within our school and the one that knows about healthcare and how medical decisions need to be made. So we are that subject matter expert. And we have the skills and knowledge for dealing with chronic and medically complex conditions. And we prepare the school staff to respond appropriately to any potential emergencies. And we're key for the wellness and safety of everyone in our buildings. So we fulfill a role as a public health nurse with not only within our school, but within our community, because we're reaching out and trying to help. And it could be just within where the school is, but it could also be within the whole district and supporting that role. And with that, we provide the expertise to support both the planning for emergency response and disaster preparedness, and in a supporting role for incident management in schools. And so we must be, and we're one of the reasons we're doing things like this, reaching out, is to let folks know that we have a voice. We have not only a voice in the specialty of school nursing, but in nursing overall, how important that nurse role is to be talking with the administrators and with the planners at the local, district and state level to be included in how it looks for nursing in the ongoing response and for the re-entry efforts for COVID-19 as we move forward into the summer and then into the fall, and how that's going to look, which we don't know right now. But it's really great for us to be recognized on this really special day for us. I mean, the proclamation from Governor Scott actually designating today as School Nurse Day in Vermont was excellent. And it's been acknowledged in a couple of other fashions from Dr. Levine, the Commissioner of Health, mentioned It was nurse either week or day. I wasn't able to watch the press conference this morning, but he specifically called that out. And there's been some tweets from Jeff Francis from the Superintendent's Association and some others that have shared out too about this special day. So it's really important. And if anybody on this call is listening later, if you would, we all really appreciate sometimes getting a little pat on the back. I mean, we do what we do because we love it. And but having that acknowledged publicly or even privately is really special to us too. And then I think I'd like to pass this along to Kelly, or I'm sorry, Soph. Soph's going to talk a little bit more about some other stuff than that.
Thank you. People often ask, well, so what does a school nurse do? And I think that one of the things that we are finding with this COVID response is more and more people don't know what we do. We are trying to make more of a statement to the general public because even within nursing, sometimes people will say, oh, you're just a school nurse. That must be the easiest job in the world. And quite frankly, it's one of the hardest jobs I've ever had in my 40 years of nursing experience because I am the only health professional in the school. And I work for a small school in a rural area where any response time for emergency is probably 15 minutes on a good day, but much longer than that in reality. So it's important for many schools as well to recognize the school nurse, and some school nurses have to really push to get more recognition, not accolade recognition, but recognition in that the role we have to play in the health of the students at the school is important, and we need to be included in those discussions. More so now with the COVID response. As the president of the VSSNA, I've also asked the governor and the Department of Education to support full-time school nurses in the schools. We have no idea what school will look like in the fall, but we have already begun making those plans, trying to identify the what-ifs. And I just cannot imagine being an administrative assistant and being expected to do the nurse's role on the days that the nurse isn't there, which is what happens typically with a part-time school nurse. And that works when you're not in the midst of a pandemic. And especially a pandemic of a disease we know little about, and we continue to learn more and more every day. I've had the pleasure of working with some amazing nurses in our state. We helped create a joint statement from other Vermont nurse leaders with the Vermont ANA, the Vermont Nurse Practitioners Association, the Organization of Nurse Leaders. I'm thinking there were 5 total, but and that's been powerful. That's been amazing to work with all of these incredible very experienced nurses and make the voice of the nurse stronger. There are more nurses in healthcare than any other profession. And by that I mean any other healthcare profession, not any other profession. And nurses continually for the last 20 years come out on top as the most trusted professional. And there's a reason for that. And we like to recognize that as well. We've done some other things. One of the responses to this pandemic, Dr. Chen, the guy at the top of the emergency operations planning for the state, was tasked with planning for the potential COVID-19 surge. And one of his goals was to identify what healthcare professionals might be able to help staff any potential surge site. And he reached out to the school nurses. And many school nurses, as Clayton said, we are dual licensed. So we're licensed by the Agency of Education, and we are licensed by the regulating board, the Board of Nursing in Vermont. We're also, many school nurses are hired under a teacher's contract, so we're members of the National Education Association. And obviously, we were concerned, we did not want nurses to not volunteer to help out, because we want to be right there whenever we have an opportunity to help out, and we have the skills to do that. But we wanted to protect the school nurse's job should that arise, and we're able to make a joint document acknowledging that with the Agency of Education and the NEA and the VSSNA.
And
as well as the
Superintendent's Association.
And the Superintendent's Association. And that's a great success for the organizations working together. And even though at this point we don't have that surge that was anticipated, which we're all grateful for, we do have that connection, that relationship that's going to be able to serve us well as we continue to move forward. And I think that's pretty important as well. Another thing that I have been, as the face of the VSSNA, I have been really strongly encouraging through the Vermont Superintendent's Association, through my own district leadership, and with the governor and the Department of Education and the Department of Health, to really make sure that school nurses are at the decision-making table. Again, like I mentioned earlier, some people don't know what school nurses do. And I think because of that, they sometimes forget that we are the health professionals. So I've been trying to make that more visible and encouraging the nurse. So we're pushing from the bottom and the top. Each school nurse is being encouraged to almost fight their way to the table if they need to. And we're also working on the leadership from above, from the other organizations, to recognize the need for the school nurse to be there. This is a health crisis. It's not an education crisis. The issues with education have come about because of the health crisis, and we all have to work together to move forward with it.
Well, I appreciate all that, Sophia, and you know, moving forward, what do you think the role of school nurses will be in the recovery process?
That's a very good question, and I think it's going to be vital. The school nurse is going to need to be, the school nurse will be able to translate any guidance that we get from the CDC, from the National Association of School Nurses, from the National Association of School Nurse Consultants, and our own Vermont State Department of Health. The nurse can translate based on our experience and our educational opportunities and our understanding of the disease process, what that will look like in the schools. So we know that we don't know exactly all of the ins and outs of this disease we're calling COVID-19, but we do know that it is highly contagious. We do know that it spreads respiratory-wise. We do know that some people don't show any signs or symptoms. Some show very mild symptoms, and others become deathly ill. So the school nurse is needed to be able to make the assessment of both the adults and the children to determine whether or not they need a different treatment, if they need to go see the doctor, if they're okay to be in school because maybe what they're presenting is not COVID, but it might be something else that's part of their chronic disease. For example, an asthmatic may have different responses, and it may not be COVID at all. We'll also help with identifying traffic flow patterns in the schools. What's it going to look like when a student and staff come to school or when they leave the school? What's it going to look like at lunch, in the classrooms? What kinds of things will need to be done to prevent the spread of that? And I know Kelly has some additional expertise to share regarding this as well.
Yeah, should I go ahead, Maeve?
Yeah, go for it.
Okay, sure. So hi, I'm Kelly Landwehr, and like you said, I'm a school nurse at Middlebury Union High School. I've been a nurse and also actually a pediatric nurse practitioner for almost 25 years, and kind of fell into school nursing many years ago and absolutely fell in love with it. So I feel really fortunate to be in this role and to be working with so many great school nurses in this state as we all come together to kind of work through this new normal and help our families and help our students and our staff and look at all of these big issues around school reentry. I wanted to speak a little to what school nurses are doing now. You know, we know that teachers are home and assisting students with navigating online learning, and so what are school nurses doing right now? And we've certainly spoken to some of that, but one thing that's important to know is that in our role in schools, even though we're typically the only healthcare professional in the schools, we don't stand alone. We work as part of an interdisciplinary team, working together to assure that students and families are supported in any way that's necessary to be sure that when kids walk in the door each morning, they're ready to learn when they arrive at school. And that means really looking out for not only the physical needs of our students, but also the social and emotional needs. These teams that we work with include teachers, social workers, guidance counselors, school psychologists, 504 and IEP coordinators, among others. So all nurses are still working with those groups and really supporting our families and our students at home through ongoing work with these groups. We're all Zooming and Google Meeting and still keeping up with that really important work. One thing that these teams are really focused on during school closure is making sure that we're letting families and students know that we're most concerned that their basic needs are being met and that emotional health is a priority. The academics are important, but you know, this unprecedented time has really shown us how many families and students truly rely on schools to provide basic physical and emotional needs. So making sure that those needs are still being met even though students are home is a really important piece. So some of the specific ways that school nurses are supporting students and families at home is a lot of nurses are working with their districts in coordinating grocery and meals programs. There's been a lot of information out about all of the meals that are being bused to kids on a regular basis, and nurses are playing a big role in that, either through coordination or overseeing these programs, making sure that safety is assured and infection control is being followed per the CDC and health department recommendations in light of COVID. Nurses are meeting regularly with their fellow district nurses, discussing how to best support families and students. So there's so much collaboration going on right now. You know, nurses have always collaborated, not only with fellow nurses and others in their schools, but I think now more than ever, it's just amazing how much collaboration is going on with different parties. We're also collaborating with the other nurses throughout Vermont, and that's just been amazing to see and really exciting to be a part of VSSNA and seeing how all nurses are coming together to meet the needs of students. Nurses are serving on their district COVID emergency response teams. They're staying updated on COVID-19 by following online updates and meeting with representatives from the health department. We're attending educational opportunities. VSSNA is hosting awesome town hall meetings weekly, and those are available to all school nurses, and we're talking about school reentry and ways to support students at home. And nurses are serving on educational support teams, sharing information and resources with families through email, through school websites, Nurses are hosting office hours and still meeting with students and families on a regular basis, touching base with families. So the list really goes on and on. I don't want to take too much time, but I could probably talk for 10, 15 more minutes just listing out all of the things that nurses are doing. So I think the biggest thing is the amazing collaboration that is happening to make sure that we're doing what's best for all of our kids and our families.
Yeah, that's wonderful. It's great to hear some more about what nurses are doing right now, because when it comes down to it, the school nurse is oftentimes a student's main point of healthcare professional in their life. So it's just another aspect of this crisis that is really concerning. So really great to hear about some of that. It looks like Becca just joined us, which is wonderful. And sorry to pass it to you so quickly, Becca, but I would love to hear you chat a little bit more about who you are, what you do, and then get a little bit into what VSSNA is doing around organizing work.
Sure. Hi, I'm Becky McCloskey, and I'm the Vermont State School Nurse Association President-elect. I'm also the school nurse at Edmonds Middle School in Burlington. So that's just a little bit about my background. As far as organization and what we're doing, it started out kind of small, but just an idea sparked of trying to answer questions for a lot of school nurses at the same time. I was in conversation with Sharon Lee Treffery at the Department of Health, and she was getting a lot of the same questions emailed to her and asked me if I had any questions. And my response to her was, what if we created a town hall meeting for all the school nurses' questions to be answered kind of at the same time? So that's how the town halls started. And as we started to think about them on a weekly basis, we really wanted to get more voices involved and really have it come from the ground up of what do school nurses want to hear about, what do they need to know, and how can we best serve school nurses. And so we asked for a representative from each school district to come forward to be on a team to plan the town halls. So the first week we had about 40% of the school district represented, which was beyond our wildest dreams. The second week it raised up to 60%, and now we're at 80% of the public school districts being represented, plus we have a few independent schools being represented. So we are ecstatic that so many people have come forward to join the conversation and participate in the planning, because it truly is the school nurses who are making the decisions and driving our agenda, which is great. From this momentum, the ask from this group of representatives was, can we have committees to discuss all these different topics that keep coming up in conversation? And so now we've established 4 committees. We have an advocacy committee, a committee looking at reentry guidelines and what that would look like for school in total. And then we have a clinical guideline committee looking at, like, what is the assessment going to look like when kids come to school, and what are the school nurses going to need to know before all this reentry happens. And then our last committee is a PPE committee for personal protective equipment. What are school nurses going to need? What is the school going to need? Who in the school needs what? So our cafeteria workers going to need something different than the custodians versus in the health office. So really great energy, a lot of conversation, thinking, brainstorming, all these great questions. But I think it's really been, it's a growing effort that started small. And when I think about it, I think about the ripple effect and how when you throw a stone into water, you don't realize how far the ripples are going to go. And so I really, like, that's really, truly what this has been. And it's been pretty inspiring, to be honest.
That's awesome. It doesn't surprise me at all to hear that nurses like yourselves are really coming to the table and making this big, huge effort to do all you can to make the recovery process as smooth as possible. And it sounds like there's a lot of details to cover. So thank you all for doing that. I'll pass it on to Clayton here to just talk a little bit as we finish up this conversation around the VSSNA's website, how to get involved, and our second webinar for International Nurses Week that we're hosting tomorrow. Clayton, I'll pass it to you.
Okay, thanks. So I'm going to share my screen and just show kind of where we are right now. Make sure I have the right one here. And so basically, we just started a new website just before all of this started, and it's given us a lot more ability to control locally what's going on the website. And with that was really great is because Lori Colm, and in this picture right in the middle of the screen, is the president of the National Association of School Nurses, and it was her message to all of the school nurses in the country about, and internationally, about thanking them for what they do and for working with her. And it was just so awesome. And I grabbed that and stuck it on, and then I sent her an email and said, hey, I don't know if I need to ask permission or forgiveness, but I've already posted it. And she was like, get it out, do as much, it's awesome. So that's on our main page. And the other nice thing about the page is that anything that we put on Facebook or Twitter feeds right onto our website. And so, and we have a bunch of our board members who have access to both Twitter as VSSNA and also Facebook. And so we get a good kind of rounded philosophy of nursing. Everyone has different interests. And so we have lots of different stuff. So our Twitter feed doesn't necessarily match our Facebook feed. And it doesn't match everything that's on our actual website. So we find that to be really helpful. But it was so exciting when we posted the actual proclamation from Governor Scott for actually proclaiming today as a School Nurse Day. I had no idea that we would have, I think we were at 2,460 individual views of that. It's the most we've ever had from one page, and it's been shared a lot. And there's lots of just Vermont nurses sharing that, but we also have neighboring states sharing it. I mentioned earlier that I also saw Louisiana's declaration or proclamation for School Nurse Day, and they're all beautiful. It's cool to have seals and different, it's just really great to see all the different states that are actually doing this and showing that thanks for school nursing. The other part that we felt that was really important, and Becca talked to this, but is we really want to have one voice for the school nurses, that they have a place to go, that they can feel comfortable getting peer-reviewed, evidence-based information. And so we started a page. So on there, we have a COVID-19 page. And this basically is a culmination of all the different things that we've done. So all the town halls that we've had are on here. The presentations for those town halls are on here. We've done Q&A, and for the ones where we actually, there's a couple of them where we don't have everything associated with it, but where we had Q&A or different presentations, it's all available in one place. So folks can go and look at that. They can watch them if they couldn't attend. Like when we did our first town hall, we had no idea what was going to happen, and we had a free Zoom, and we hit 100 people, and a whole bunch of people didn't get to see what they wanted to see, but we had the recording, which was great. So as we've moved forward, we were able to get Zoom. We've tried a couple of different platforms, and we've really found that Zoom is a very powerful way to do that. So anybody that would like to can go in and watch these. We actually have our own YouTube page also. So I post them there, and it's also on here. And it was pretty exciting when we did part 5. So when Dr. Holmes spoke to us last week, we had 158 folks listen in, which was awesome. And I posted that about 1 o'clock in the afternoon, and within 16 hours, it already had like 65 additional views. So that was a huge draw. And Dr. Holmes was great, and she has said she'll come back as often as needed, because she is definitely a very positive voice for school nursing, and can provide some help with us to get that voice where we need it, and to help with some of the things we're trying to do with being included in the planning process. And then the exciting thing for this week is that, so Lori Holmes, president of the National Association of School Nurses, and Donna Mazik, who is the executive director for the National Association of School Nurses, they're speaking for at our webinar tomorrow, our town hall. And so both of them will be on, and they're going to talk about how school nursing is being affected nationally and internationally. And I asked for them in an email today to talk a little bit about the successes and failures, things that they're seeing that are really working well. How are we collecting documentation so that we have the right information to share with nurses and get that information out on a platform? And we're lucky with our website. Our website is actually embedded in the National Association of School Nurses website. So it requires a membership within VSSNA and NASN to get to some of those features, but there's a lot of information that we can still grab and share with others that aren't members. But and Becca, I apologize if I didn't hear this part, but or Soph, if you mentioned this, but before COVID, we had 104. We were kind of sitting at 104 members of the VSSNA. In the last 3 weeks, we are now seeing we have 141 members. So our organization has grown. It's becoming stronger because we're all learning together, and it's, I think, showing how important the VSSNA as a organization, as a professional organization with our mission being to support school nurses and to also support the students being healthy and ready to learn. I mean, all of the things are really important. So our website has given us a part of that, but each of these different projects that we've worked on has made us even more powerful. The fact that we have 80% of the school districts in the state for the public schools and a good portion of the very large independent and private schools covered, we're really learning a lot of different pieces of a large puzzle and learning together on how to make it so that we can get that information out and help all of our students and our families and our staff and do it appropriately. And so the other part, I was just looking at my watch, but the other part of this was, and Soph talked about this a little bit earlier. So about 6 weeks ago, I was sitting in my office and thinking, how can we be more accepted? How can school nurses be heard better? And I was like, we used to have an affiliation with the Vermont ANA, and Becca and I actually started to go to some of the legislative sessions and or if on the going to the Capitol and listening in on what's going on. So I emailed Meredith Roberts and I said, hey, would you like to make a joint statement? And Meredith was like, hey, that's a pretty good idea. So we started working on that, and then we got our whole executive team together working on that. And then Meredith brought in the Organization of Nurse Leaders and the Vermont Nurse Practitioners Association, and then of course the Vermont ANA Vermont. And we came up with a really powerful joint statement that got sent to the governor and to Dr. Levine and Secretary French and a bunch of legislators, and just stating, and a lot of what we talked about in the beginning was about PPE, because PPE has been such a huge concern and still is, but it's blossomed into a really amazing, so we have this new Vermont Nurse and Nurse Practitioner Coalition, and we are exchanging ideas and information and the impacts on nurses, and trying to get the same word out that we're trying to share with school nurses, and people understand that it's not just one specialty, it's every specialty in nursing that's being affected by this, and how we can all be more powerful. So Soph alluded to this. There's approximately 4 million registered nurses in the United States, and there's like 95,000 school nurses in the United States. And so in Vermont, we're I don't remember the number for registered nurses, but school nurses, I think we're at about 280 or so. And so being part of a larger group helps us get more of a voice when it comes to some of those things. So the exciting part is that we will have a leader from the Vermont ONL, Vermont ANA, the Vermont Nurse Practitioners Association, and the VSSNA talking tomorrow about the broader impacts on nursing, and the fact that this is not only Nurse Week, but it's also the International Year of the Nurse and Midwife. And so recognizing those pieces of it, and there will be more to be said about that tomorrow. So I'm really glad that we've had an opportunity, honestly, to talk about our website and some of these other topics. So that's all I think that I have for on the website, and I'm not sure what else we have planned now.
Yeah, I mean, we can wrap it up there. I just, want to thank you all for being here. And on the front of legislative action, us at VPIRG, in the past have worked on healthcare issues, and a member of our board, Dr. Michael Scollins, is always trying to get us to be more involved with those with healthcare issues. So especially in the wake of this crisis, you know, we're always thinking about other ways that we can get involved on that front. But yeah, tomorrow is going to be a really, really great webinar again on the more general impact to nurses, but I'm so glad that we were able to really dig into the issues facing school nurses and the ways that you all are going to really be integral to the recovery process. So I'll open it to the floor if any of our speakers would like to add something before we close out. And it looks like Claire Molnar added that you're doubly appreciated as nurses and teachers, as you all are. So. And
in full disclosure, Claire is on our board.
Oh, wonderful.
But I just wanted to mention that, but she's right. It's Teacher Appreciation Week. It's Nurse Week. It's School Nurse Day. It's huge, and teachers are working incredibly hard to support their students in so many different facets and learning of this whole distance learning piece. And you know, we talked about mental health of students and families, but for staff too, and for the nurse staff as well as the teaching staff, it's been a long process, and we're still learning, but it's really important. And I'm glad that Claire pointed that out, because we do have and many of our nurses actually are dual endorsed in teaching as well as in nursing. So that's a great point. And Soph pointed out something really important too. The ANA actually changed it from Nurse Week, and they actually changed it to let's celebrate Nurse Month. It's that important, and with all of the impacts that COVID has had on all aspects of nursing and all healthcare. I mean, the respiratory therapists and the doctors and the folks that are just working in any capacity anywhere, essential or what otherwise. It's been huge, and everyone needs to be celebrated, and it's nice that we are being acknowledged, but that celebration is going to have to be larger and reflected as we are actually able to open back up into it safely, of course.
Yeah.
This is Claire. If I could stick one thing in, this is my I'm one of those people who's dually endorsed, so I teach in the morning and then turn into a nurse, or the other way around. One of the things I was going to say is that one of the things that seems to be the biggest part of my practice now is parents. I think I probably spend as much time online with parents freaking out, largely social emotional issues, but it stretches the role even further sometimes. And I'm used as much for medical expertise as I am for simple, Mom, it's okay, you've got this. I will say I got a letter from my superintendent this morning saying Happy School Nurse Day, and your role in COVID planning has been appreciated. So we're going to continue that. Anyway, thank you.
Yeah. Well, thank you for jumping in there, Claire. And before we close out, I just wanted to say thank you again. And if anybody has anything to add, that'd be wonderful. But otherwise, happy School Nurse Day here in Vermont.
Thanks, Maeve. Be well.
Yeah, you as well.
Thank you so much.
Thanks.
Thank you so much, Maeve. Thanks, everybody.
Yeah. All right. Bye.
Bye.